everyone, and welcome to BSN1194. Today's presentation is done by Kelly, Robin, Emily, and Ladia. We're going to be showing you how to properly assess the cardiovascular system, focusing in on the heart and neck vessels.
When performing a regional cardiovascular assessment, use this order: pulse and blood pressure, extremities, neck vessels, and the precordium. The logic of this order is that you will begin observations peripherally and move in towards the heart.
Hi Emily, I'm Kelly and I'm going to be your student nurse today. I hope you don't mind, but I'm going to complete an assessment of the heart and the neck vessels on you today.
Okay.
Alright, just to let you know, I've provided privacy and hand hygiene.
The first step in assessing the neck vessels is to palpate the carotid artery.
Can you turn your head to the side? Thank you.
This is located central to the heart. The carotid artery yields important information about cardiac function. Palpate each carotid artery medial to the sternomastoid muscle in the neck. Take care to palpate gently, palpating only one carotid artery at a time to avoid compromising arterial blood to the brain. You want to feel the contour and amplitude of the pulse. Normally the contour is smooth with a rapid upstroke and slower downstroke, and the normal strength is 2+ or moderate. Your findings should be the same bilaterally.
My findings are the same bilaterally.
The second step is to auscultate the carotid artery. Using the bell of the stethoscope, place it on the carotid artery, and what you want to hear for is the absence of a bruit. This is a blowing, swishing sound indicating blood flow turbulence, so normally none is present.
There was no brewery present.
Third, we inspect the jugular venous pulse.
Can you turn your head to the side, please?
From the jugular veins, you can assess the central venous pressure. This is used to judge the heart's efficiency as a pump. Look for pulsations of the internal jugular veins in the area of the suprasternal notch or around the origin of the sternomastoid muscle around the clavicle. You must be able to distinguish internal jugular vein pulsation from that of the carotid artery. We will now move on to the precordium. First, inspect the anterior chest.
Okay, Emily, I'm just going to inspect your anterior chest.
You may or may not see the apical impulse, the pulsation created as the left ventricle rotates against the chest wall during systole. When visible, it occupies the 4th or 5th intercostal space, at or inside the midclavicular line. It is easier to see in children and in those with thinner chest walls. Second, on the exam, we will palpate the apical impulse. Localize the apical impulse precisely by using one finger pad, asking the person to exhale and then hold it.
Can you exhale and hold it, please?
This aids the examiner in locating the pulsation. Next, we palpate across the precordium.
Okay, I'm just going to palpate your chest, okay?
Using the palmar aspects of your 4 fingers, gently palpate the apex, the left sternal border, and the base, searching for any pulsations. Normally none occur. If any are present, note the timing. Use the carotid artery pulsation as a guide, or auscultate as you palpate. We're moving on now to percussion. Percussion is used to outline the heart's borders, but it is often displaced by chest x-rays or echocardiography, which are much more accurate methods of detecting heart enlargement. Slide your stationary hand towards yourself, percussing as you go, and note the changes of sound from resonance over the lung fields to dull over the heart.
Next, you're going to listen to the heart sounds. Focus on systole, then on diastole, and listen for any extra heart sounds. Listen with the diaphragm, then switch to the bell, covering all osculatory areas. Listen for murmurs. A murmur is a blowing, swooshing sound that occurs with turbulent blood flow in the heart or great vessels. Note the rate and rhythm. The rate ranges normally from 60 to 100 beats per minute.